Do you have a little one who's been digging at their backside, scratching incessantly to the point that they feel like they're going crazy, they're crying, they just cannot stop itching? Well, stay tuned because I'm going to tell you what that could be. Let's talk about itchy rear ends. Let me be the first to tell you that it doesn't matter who you are, your child will get pinworms. Full stop. They do not discriminate. Consider it a rite of passage of childhood of sorts. All three of my children have them, full transparency. The parasite takes advantage of children's really bad hygiene, and so it's a really common thing that kids get. So what are pinworms? They are a type of parasite that are very commonly found in soil and on surfaces. The larva can survive on surfaces like toys, bedding, tabletop surfaces, things like that for up to 2 to 3 weeks. The way that your child gets infected with them is that they touch these surfaces, the larva or the eggs get underneath their fingernails. Sometimes they are reinfesting themselves from scratching their bottom. Sometimes they're getting it from toys from other children, but they can also get it like playing in the dirt outside or in sandboxes. There's been larvae in situations like that they get it under their fingernails that way. They're kids, so they put their hands in their mouth, bite their fingernails, whatever it is. They don't wash their hands really well, and then eventually their hands are in the mouth. They ingest the larva. The larvae go into the stomach, into the intestine. The eggs hatch. The worms then migrate down through the intestine, through the rectum, and they are nocturnal parasites, meaning they are active at night. And so the females wiggle out to the perianal area, and that's where they lay their eggs. That's why most of the itching can occur at night, and the child's waking you up in the middle of the night crying because they're so itchy. So how do you know if your child has pinworms? Well, there's a rule in my house that I've had since my first one had one. If I see you scratch back there more than once or twice, you're getting treated because it's probably pinworms. I just keep the medicine stocked at my house, and if I think it, you're getting treated. One way you can know for sure is you can examine that area. Sometimes if it's active right when they're scratching and you look at that time, you might see one of the worms wiggle out. Just be prepared. You're not gonna be ready for it. It's gonna be very shocking and gross you out. It was the first time I noticed one on one of my children. The other thing you can do, because they're nocturnal and come out at night, is you can go in there with a flashlight at night, pry the little boob cheeks apart, and you might see some of the adult worms there laying their eggs. You can look and you might see some of the eggs around the anus as well. Or you can do a tape test, which is where you take a clear piece of tape like that you wrap presents with. Don't use the kind that's kind of foggy or glazed. Use the clear and then press it to the perianal skin first thing in the morning, and then you can take it off and you can look at it yourself. You might see some of the eggs or worms on it. If your pediatrician agrees, you can take it to them and they can examine it as well and let you know. You may also see them in stool. A lot of times you'll see some live worms in the stool or some dead worms after a treatment. So you can look in the stool, they look like little thin white threads. But again, it's a clinical diagnosis as well, in my opinion. So like I said, if you just see them and they're scratching nonstop, it's probably pinworms. So how can you treat pinworms? They're very easily treated. That's the best news. What we most commonly use is over the counter. The brand name is called Reese's pinworm medication. It usually comes in a yellow and green and white box. It's over the counter. You can buy the generic store brand for it, and that's totally fine. Oftentimes you can find it in what's called the family pack, and the reason it comes in a family pack is that we recommend you treat everybody in the family, because sometimes the eggs are on your bedding because the little one has been in bed with you or slept with a sibling. So it's a good idea just to treat everybody, and while you're doing that, you want to wash all bedding on the really high temp sanitized cycle to kill all of those eggs that may be remaining on the bedding. We oftentimes recommend repeating the treatment again in 2 weeks just to catch some of those pinworms that maybe hadn't hatched yet the first time around. But it's over the counter. You go by the side of the box, it'll tell you the weight-based dosing for everybody in your family. It's a liquid and it's banana flavored. So grab you some of that. I got to a point where I just kept that stocked in my house, and if I saw one of them dig, everybody got treated. And so if I ran out and used it all, I put it on my Walmart order for the next time around. I think now we're out of the age where I think we're out of that window, but you never know. But really, I know it's gross and it's gonna really gross you out when you see it, but it's really common. Don't be upset about it. Are you wondering how you can prevent pinworms? Well, it's really hard. It's just the nature of the beast and the age they're at and just the bad habits that they have. Things you can do: good hand washing, of course. Talk to your child about not putting their hands in their mouth, not biting their fingernails. You can get you a nail brush and clean underneath their nails really well every time when they're in the bath, and that can help get out some stuff that's built up underneath there, and that can be helpful. But at the end of the day, it's very benign. It really doesn't cause any other problems other than the itchy bottom, and it's over the counter treated. And so if you see it, don't let it upset you. Don't let it make you feel like it's a reflection of your parenting or the cleanliness. It's kids. So pat yourself on the back. Hey, you got a real kid at home. If you have questions, you want us to take a look, I saw one today. That's why I got on and made this video, because we see it frequently. Ask any pediatrician. If you have other parents and friends who could benefit from this video, you know what to do.